Charlie, if you could, tell us a little bit about the experience you had with your partial and the problems you had with it prior to getting your dental implants.
If you've ever had bad teeth, okay, it's hard to describe the misery of having bad teeth. Let me just say it that way. I had great teeth until I went into the service in the big war, and I came out of that 3 years later with terrible teeth and a lot of GI dentistry, so to speak. I had found what I considered to be a great dentist, and he moved to Huntington Beach. So he became geographically undesirable for me. And I didn't like dentistry at all, okay? And one thing that I didn't like was being hurt, okay? I was never a good patient, okay? And I had a partial for geez, I don't know, 15 years, I would say, okay? And finally, the teeth started getting loose, okay? And looking bad. I grew a mustache to hide the smile so that the aesthetics, you know, wasn't, and I used to grow it longer, okay, down over the lips so you couldn't see what I was getting into.
I see you've shortened it now.
Yeah, well, you know, now I got teeth I can show off. Okay. One day, I was in a meeting talking, and as an architect, one of the things that I have been doing for 30 years, and I do very well, is paint word pictures. And so I'm having to paint a word picture to a client about what it is that we're going to do to spend their money.
A project,
right. Okay, I'm getting ready to spend their money, and so one of the things you do is you paint these word pictures as to what they're going to be, okay? And this lower tooth fell out.
In your presentation?
In the presentation, okay. I now got this thing in my mouth, okay? So, and you're in the middle of a presentation. So I apologize. I tell, it's obvious I'm having difficulty.
Some problem.
And so I leave. I get in the car. I go home. My wife uses crazy glue to fix broken fingernails. Okay. Being a practical man, I crazy glue this thing back into my face.
This is all straight, right? Yeah. Okay.
Would I lie? I mean, I'm telling you, want to know what happened, okay? What was my lifestyle before, okay? And so I operated on the crazy glue tooth there for, I would say probably a week. Carried the glue around with me, and you know, it fell out, and I got very good at it, okay? And you know, scrape the stuff off, glue it, zip it back down in the hole, and finally. Being semi-practical, okay, it's obvious that you can't continue your life like this forever.
Sure.
So I asked my secretary if she could find me a local dentist, because I didn't know anybody. My man was in Huntington Beach. So she said, yeah, my dentist is Dr. Markham, and he's down here at Hawthorne and 190th. I said, terrific. Close, make me an appointment. So we made an appointment. I came down to Markham, and I think I shocked Markham because I said, now Dr. Markham, I have this problem here, and I took this to him, and I said, is there some way you can fix this thing? And he looked in my mouth and he says, you've got a lot more problems than that. There's a doctor across the hall named Dr. Barbanell, and I really think that you ought to see him before we start the body and fender work over here, because he said, you got a lot of problems. And I said, oh, okay. Barbanell chopped the end of the thing off and bonded the whole mess of loose teeth together so that everything would stop moving around.
So the teeth were then stationary?
Yeah.
Your own teeth were stationary?
Yeah, my own teeth were stationary, but I had a lot of gum disease. But the thing about cutting the bottom of this one tooth off, I thought was kind of neat, because then the gum started to heal itself.
Right.
The partial that I had, because I didn't have any teeth over on this side, and of course there was a gold clamp hanging around out in the front. Okay. I'd had that thing for so long, and I wore it down. I mean, I wore out teeth on it. I got down into the gold. I think I got down into the into the base metal or what the heck ever is inside of this thing. But you know, it was just a and having a partial is really a drag. You know, I mean, there's
in and out.
Well, it's in and out, and plus you like even today, I have been chewing on my right side for so long, and I've got a full head of teeth now, okay? And I know the left side is available for chewing. I haven't even figured out yet how to get my food over there to chew on that side, because I've been working on this right side so long.
Because you were so used to chewing on that side because of your partial.
You know, and of course, the worse your teeth get, the more you scan the menu as to what you can eat and what's comfortable for you to eat. It's really weird to be eating something and all of a sudden you're eating the damn partial. I mean, you know, the whole thing is in here with the potatoes and the gravy, and it's, you know, and you're trying to clean it out underneath and get it back in place. You know, and you got the napkin up here supposedly wiping your forehead and manipulating it. It's ridiculous, you know. It really is. So.
Well, you're glad you're rid of it, obviously.
Oh boy, am I glad I'm rid of it. I'm very glad I'm rid of it.
Okay, great. Tell us about your teeth now. Your own terms were that you have a full set of teeth now, full head of teeth.
Right.
And they're permanent teeth. They're not going anywhere.
You got it.
You take care of them just like your own natural teeth.
No, I take care of them better. A lot better. The most poignant moment in my life as a product of these implants was biting into an apple.
I bet.
I mean, I can't tell you. It's been 20 years since I picked up a big old red apple and did that.
Great.
You know? Corn on the cob. You know, I can cut corn off the cob blindfolded because I love corn on the cob, but you can't eat corn on the cob. So you cook corn on the cob and then you cut the corn off the cob and then you eat the corn. Okay. And it is such fun.
That's great.
To eat corn on the cob.
You're in business for yourself. You deal with clients on a daily basis. You're selling yourself all the time. Obviously, your appearance has a lot to do with your success. Tell us how your dental implants have helped you in that regard.
To me, they're extremely important. I have a client who has a black front tooth, dark front tooth, let me say it that way. And he's had it for as long as I've known him. And I don't know, maybe it's a dead tooth, but you know, it's a funny thing when somebody is all dressed up and they look really neat, okay, and your fly is open, okay. I mean, the only thing that they see is that. They don't see the fact you're standing there in a $700 suit and you just got a haircut, okay? Well, the only thing that shines through out of somebody's face is, you know, is a black. And so I think when you aesthetically, you know, when you smile and there is something that is not visually pleasing, that's what people see.
Let's talk a little bit about self-confidence.
Well, I've always had a lot of self-confidence, but the one thing about the implants is that you forget your teeth. I mean, I don't think about my teeth anymore, and I don't care how much confidence you have. If your teeth are in the possibly falling out on you, or if the blasted partial is getting ready to drop, you know, that is subconsciously, it's always in the back of your mind as you're talking, as you're presenting, as you're eating it. You know, it's a lousy thing to have, you know, the teeth in your head. I mean, life is tough enough. There's so many other things you got to take care of, and just, you know, going through life without having to worry about your teeth. Sure. If I can make this easier for, you know, another patient or for someone else who is thinking about this, if anything I've said will help you get in here, because you know, there's no point in wasting your time being uncomfortable for any longer. I mean, there's just the technique is available to us, and you should take advantage of it. You really should.